Holistic Eastern Complementary and Alternative Medicine, abbreviated CAM, and Complementary Health Approaches, abbreviated CHA, are just some of the many terms used to describe complementary and integrative health, which is abbreviated CIH. Over time, complementary and integrative health has taken an inclusive position, combining conventional medicine with additional complementary approaches. Holistic nursing, with its client-centered approach to healing the whole physical, psychological, and spiritual person, can be incorporated into all nursing practice areas regardless of the nurse's educational background. Nursing with a holistic perspective embraces the client and enhances care throughout the lifespan, from birth to death. Conventional medicine, also called Western medicine, is where doctors, surgeons, and other healthcare providers who practice rely on evidence-based medicine to diagnose and treat symptoms and conditions. Western medicine uses scientifically proven methods to improve your overall health. Modern medical treatment most commonly includes using prescriptive medication, radiation, or surgery. Conventional medicine is also known as mainstream biomedicine, allopathic, or orthodox medicine. Complementary and integrative health views health and wellness through a broader lens and seeks to bring the client to their best state of wellness. This approach is combined with and ideally complements conventional medicine. CIH's multiple disciplines include manipulation of the body, energy, movement, traditional indigenous world therapies, and use of herbs, vitamins, and minerals. The National Center for Complementary and Integrative Health mission includes research and scholarly pursuits intended to promote and improve health and well-being using complementary and integrative healthcare approaches. Complementary health approaches are classified by how the therapy is delivered, whether it's nutritional, psychological, physical, or a combination of those. Nutritional approaches include herbal therapies, dietary therapies, nutritional supplements, vitamins and minerals, and probiotics. These non-prescriptive products are generally sold over the counter and marketed as dietary supplements. Psychological approaches focus on interactions between the mind, the body, and the brain to positively affect physical functions and promote health. Examples include relaxation, meditation, mindfulness-based stress reduction, biofeedback, hypnosis, and prayer. Physical approaches focus on hands-on the human body's structures, bones, joints, soft tissues, and systems like the circulatory or lymphatic systems. They include massage, chiropractic medicine, osteopathy, manipulative therapy, heat and cold therapy, and reflexology. Bioengineeric therapies are practices involving manipulation of human energy fields to affect well-being. These fields can be considered either veritable, measurable, or putative, assumed. Variable energy relies on electromagnetic fields like those generated by magnets or light therapy. In contrast, putative energy, biofields, is based on the concept that humans possess subtle forms of energy. Energy therapists influence biofields by acupressure or other hands-on manipulation of these fields in and through the body. Examples include healing touch, therapeutic touch, Tai Chi, and Qigong. Other types of complementary approaches to health include whole medical systems, Ayurveda, traditional Chinese medicine, that have developed over time and in different cultures, separate from Western or conventional medicine practices. Traditional healing is based on indigenous knowledge, theories, beliefs, and experiences. More contemporary practices, such as homeopathy and naturopathy, have also evolved as alternative systems of care in recent years. Combined approaches include yoga, bioenergy therapy, mindfulness, eating, and dance, art, and music therapy. Complementary and integrative health in the United States. A joint analysis reviewed data from the 2022 National Health Interview Survey, and researchers found that 12% of children and 30% of adult Americans practice complementary approaches to healthcare. More than 17.7% of adults use some form of a natural product, that is, a dietary supplement other than a vitamin and mineral, with fish oil being the most commonly used. When comparing data from the 2002 survey, researchers found the use of select complementary therapies like yoga, acupuncture, chiropractic, guided imagery, massage, meditation, and neuropathy increased from 19.2% of Americans in 2002 to 36.7% of Americans in 2022. The alternative medicine industry revenue in the United States was expected to be approximately $30.6 billion in 2023. Additionally, 24% of Americans use some form of a natural product, that is, a dietary supplement other than a vitamin or a mineral. In recent years, more and more Americans, especially U.S. military personnel, veterans, their families, and clients with cancer, have gone to their primary caregivers with regular use of natural products, yoga, or meditative practices, mental health, and cultural beliefs already firmly in place. Given this widespread use of CIH, it is vital that nurses educate themselves on evidence-based practices geared toward more holistic and client-centered care with an emphasis on mental, physical, spiritual, emotional, functional, social, and community aspects of client health and wellness. As the U.S. population grows more diverse, nurses also need more education about evidence-based practices that reflect culturally congruent care within distinct communities. Nurses' knowledge of meditation, spinal manipulation, acupuncture, and in yoga, for example, increase connections with clients who engage in these practices and their perceptions of health, thus increasing client satisfaction and helping decrease disparities by increasing participation in healthcare. Underserved populations can benefit greatly from nurses who embrace cultural perspectives. The healing arts include both complementary therapies, which are used along with conventional medicine, and alternative therapies, which are used as an alternate to conventional medicine. Integrative therapies gather all three, conventional, complementary, and alternative therapies, and interweave those practices into knowledge to treat the client by engaging mind, body, and spirit. Practitioners of CAH consider the many interdependent parts of the client to treat illness and disease. In this framework, healing is accomplished by treating each individual person as a system of interrelated causes and effects using conventional and contemporary therapies in an integrative manner. For example, cooling sunburn with a topical aloe vera in addition to giving an oral anti-inflammatory medication, or inhaling the essence of ginger to decrease post-operative nausea and vomiting before using an antiemetic medication. Hypnosis for smoking cessation, along with a physical medical patch. Holistic nursing. The terms holistic medicine and holism come from the Greek word holo, meaning whole. Holistic nurses look at all aspects of the client. They use a variety of healing and integrative therapies. They use imagery, visualization, relaxation, deep breathing techniques, stress management, aromatherapy, and energy therapies for clients in all practice settings. Holistic nurses understand the scope of practice for conventional and non-conventional providers of health. For example, a client visits a practitioner with complaints of a headache. Instead of recommending only a Western medicine for relief, the holistic nurse considers factors such as stress, diet, sleep, and personal and spiritual concerns with the aim of both relieving the current pain and preventing future occurrences of headaches. Holism dates back thousands of years to Indian Vedic culture. More recently embraced by Florence Nightingale and her disciplines, holism has gained favor in nursing due to its broad view of humans and illness-wellness as a summation of the parts contributing to the whole, which stands in contrast to the reductionist model of conventional medicine. Many health problems commonly seen in the United States can be casually related to stress. Holistic nurses can offer themselves as an instrument of healing to empower their clients by assisting and teaching therapeutic techniques for relaxation. These therapies include deep breathing, meditation, guided imagery, aromatherapy, and use of essential oils to bring on the relaxation response. Teaching the client to perform these therapies without a nurse prompting encourages active participation in their own health care, including family members and caregivers, and education also gives them a sense of helpfulness and usefulness in their loved one's healing process. Simple actions such as massaging the hands of someone who has dementia can reduce stress and bring ease in both the client and the caregiver. Holistic nursing is a client-centered approach to healing by way of treating the whole physical, psychological, and spiritual person and reinforcing the body's innate ability to heal itself. Nurses do not produce medical outcomes. Instead, and more importantly, they facilitate wellness by transforming the healing process, intervene proactively for improving outcomes, promote healthy lifestyles and environments, and practice individualized, complementary, and integrative approaches. Holistic nurses emphasize client self-care, being present, having mindfulness, and applying therapeutic use of self. Mind and body therapies. Mind and body are two interconnected parts of a person's whole mental, physical, emotional, and spiritual well-being. Therapies focused on the mind and the body aim to decrease stress, anxiety, depression, and pain. Clients' active participation in their own health and wellness is at the center of care. Commonly used mind-body practices include massage, meditation, and mindfulness, aromatherapy, acupuncture, chiropractic, music and art therapies, hypnotherapy, relaxation therapies such as deep breathing, guided imagery, yoga, progressive relaxation, and energy therapies such as therapeutic touch and healing touch. Research indicates that the most commonly used types of complementary health practices among U.S. adults include chiropractic, yoga, and meditation. The practices of deep breathing, mindfulness, meditation, and prayer are widely used mind-body interventions. Deep breathing involves conscious control of the breath by rate, fast or slow, by depth, deep or shallow, and by body part, chest or stomach. Deep breathing can be done alone or with other meditative practices as a means to decrease anxiety and stress and improve mood. Meditation is the practice of quieting the mind, engaging in deep contemplation, or emptying the mind. Its main purpose is to develop mental relaxation and psychological balance, but with focused attention, such as deep breathing, can also help manage physical manifestations of stress, for example, by lowering blood pressure and heart rate. Mindfulness practice entails paying close attention to immediate experiences and being mentally in the present moment. It is characterized by attention to the surroundings and to what is occurring in and around the person. Mindfulness also refers to a meditative concept wherein attention is focused specifically on breathing, guided imagery, or other practices that help to relax and restore the mind and body. Mindfulness-oriented recovery enhancement is a combined health approach to concurrently treat both chronic pain and opioid use disorder. MORE, which is the abbreviation, teaches clients to use mindfulness to reconstruct negative thoughts that heighten pain and drug use into something more pragmatic to reduce suffering and promote positive coping skills. Clients using this combined approach have shown decreases in drug use, pain, depression, and anxiety, and an increase in energy and a greater sense of well-being. Transcendental meditation is an ancient Hindu practice of sitting quietly while repeating a mantra for meditation. Prayer is a personal act, much like spiritual meditation. It can be described as communicating through inward conversation or a communion with a higher power of choice. Yoga. A national health survey in 2022 showed that 15.8% of Americans participate in yoga, which is the second most commonly practiced contemporary health approach in the United States. Much like Chinese Tai Chi or Qigong, yoga or Hatha yoga is often called meditative movement. This ancient Indian art combines physical postures with breathing exercises and may include meditation. Many clients engage in yoga to improve anxiety, stress, sleep, and life balance, for relief of lower back and neck pain, and to lose weight. Yoga's efficacy in mental and physical health is believed to result from the hypothalamic pituitary axis's effect in moderating the adverse release of cortisol into the body's cardiovascular, neuroendocrine, and central nervous systems. Numerous positive studies have been conducted on yoga and its usefulness in areas such as mental health, anxiety and depression, and chronic pain. When used in combination with other therapies, it can have a number of positive outcomes. For example, yoga and meditation can be used together as a meditation-free alternative in smoking cessation. Despite yoga's popularity and health benefits, research has revealed underrepresentation of people of color and those of low socioeconomic backgrounds in yoga practice. Disparities in access reflect structural health inequities that can decrease utilization of yoga and its health benefits in communities of color. Aromatherapy is the use of a natural plant extract in topical creams, lotions, essential oils, or aromatic diffusers for the improvement of physical, mental, or spiritual wellness. The therapy is performed through inhalation or topical application of the oils. Many different scents are used for relief from insomnia, anxiety, nausea, or vomiting, or to boost energy and mood. When used with massage therapy or acupuncture, particular scents can stimulate specific responses such as relaxation, reduced anxiety, and decreased pain. Studies have found significant reductions of postoperative anxiety with a lavender sandalwood blend, and tests of peppermint oil showed positive effects in reducing postoperative nausea and vomiting. Other widely used scents include lemon, orange, cinnamon, eucalyptus, rosemary, and sage. Aromatics and essential oils have a long history of therapeutic uses in ointments and salves for stimulation, sedation, and other disorders in ancient Egypt. Historical use is documented in the Bible, and the burning of aromatic plants in religious ceremonies date back to the Middle Ages. Although the term aromatherapy was coined in the early 20th century, research in this area did not gain momentum until the latter part of the 1960s, when investigators began looking at the neurobiological effects of odors on the human brain. Since then, many studies and clinical trials have focused on aromatherapy's benefits in manifestation management, infection control, and quality of life, especially in clients who have cancer. Management of manifestations include incorporating essential oils such as chamomile into massage, inhalation of lavender and bergamot during radiation therapy as a means to reduce anxiety, massage with lavender and tea tree oil as a sleep aid, inhalation of a 2-to-1 mixture of lemon and ginger to increase salivation following radiation treatments, and inhalation of orange to relieve nausea. Therapeutic aromas continue to be researched and incorporated into conventional medical practices. Acupuncture is a professional procedure in which long, thin, sterile needles are used to penetrate the skin and stimulate by hand and/or electrically anatomic points in the body to improve short and long-term physical function. Needling techniques vary and can be influenced by whether the practitioner is Japanese, Chinese, Korean, or American. Research has found clinical benefits in relief from chronic headaches and osteoarthritis. Vital to traditional Chinese medicine for more than 2,000 years, acupressure may or may not include needles. This technique focuses on neural paths called meridians to unlock qi, pronounced qi, and rebalance the flow of yin and yang, returning the body to a former state of wellness. Hypnosis or hypnotherapy refers to an altered state of consciousness achieved through relaxation and a focused attention to suggestions made by a hypnotist, also called a hypnotherapist. In a hypnotic state, which resembles sleep, the mind is inactive. At the same time, the subconscious mind is susceptible to positive suggestions like alterations in emotions, thoughts, or behaviors. Hypnotherapy creates a heightened sense of focus and attention. Hypnotherapy is used to treat phobias, anxiety, and pain, and to rid clients of bad habits like smoking and addictions. Biofeedback is a mind-body regulation of bodily functions, often assisted by electronic devices. It is often used to regulate breathing and heart rate, improve health by reducing stress and eliminating headaches, recondition injured muscles, or alleviate pain. While the client consciously concentrates on what is happening within the body, the biofeedback device monitors heart rate, brain activity, or even muscle tension to stimulate positive, preferred outcomes. Manual therapy, also called manipulative therapies, utilizes hand-on techniques to help alleviate pain, improve mobility, and foster better body function. Massage, chiropractic, and osteopathic treatments are all therapies that manipulate the body in different ways to alleviate a variety of disorders such as pain, headaches, and musculoskeletal problems. In 2022, chiropractic was the third most commonly used complementary health practice in the United States after meditation and yoga. Massage therapy is an ancient therapy of manipulating soft tissues with the human hands to obtain relief from pain. Techniques can include rhythmic pressure, friction, or kneading of the skin, muscles, tendons, ligaments, or fascia of the body. Massage is often combined with other complementary therapies such as aromatherapy, biofield, acupressure, deep breathing, mindfulness, and meditation. Massage is therapeutic in the treatment of lower back pain, neck and shoulder pain, headaches, arthritis, and even mental disorders such as anxiety, depression, and attention deficit hyperactivity disorder. When the therapy is contemplated, the nurse should encourage the client to weigh the risks and benefits of massage. Although adverse effects are rare, potential complications can include blood clots, nerve injury, or bone fractures among older adults. For clients taking anticoagulant medications or those who have a low platelet count, bleeding or bruising may occur with energetic massage. Avoid massaging over areas of tumors, blood clots, and prostheses. Reflexology is a method of massaging or manipulating the feet and hands' reflex systems to positively influence the body's functions related to pain, stress, and other dysfunctions. Anatomic charts guide the practitioner to the different areas of these extremities that correspond to the body's anatomy. Chiropractic medicine uses manual therapy and spinal manipulation, focusing on the body's physical structure, primarily the spine, and its relationship to functionality. Treatments assume that spinal misalignments are the cause of illness and emphasize the body's ability to heal itself. Chiropractors approach client care much as practitioners of conventional medicine do. Specifically, doctors of chiropractic obtain detailed client histories, perform examinations, tests, and creates plan of care before starting treatment of the musculoskeletal system. Prescription medications and surgeries, however, are not part of chiropractic treatment. The manual therapy includes stretching, massage, pressure to and manipulation of joints, and quick, gentle thrusts to treat head, neck, and shoulder pain, sports injuries, and even carpal tunnel syndrome. Non-manual therapy may include applications of heat or cold, ultrasound, transcutaneous electrical nerve stimulation, those are TENS units, and nutrition. Osteopathic medicine is a healthcare system concentrating on structural and anatomic abnormalities that cause disease. Treatment seeks to rebalance structure and function. Conventionally trained physicians use osteopathic manipulation tendencies to treat both musculoskeletal and non-musculoskeletal diseases. Biofield therapies are a discipline that studies the effects of our subtle energy field. The subtle energy system consists of three main components: chakras, meridians, and aura. Meridians are countless lines of energy traveling all around the body. Chakras are energy centers that are capable of corresponding to certain internal organs or nerve bundles. The body has trillions of particles and subatomic particles that spin and move in groups of particles. When these particle waves are out of tune, it affects the human body, causing suffering and imbalances physically, emotionally, and mentally. Biofield therapies are non-invasive and have been used for centuries. Studies show that 1.6 million people use energy healing, aka biofield therapy, at least once a year. Types of biofield therapies include healing touch, Reiki, and Qigong. Healing touch and therapeutic touch are forms of energy therapy in which practitioners consciously use their hands in a heart-centered and intentional way to support and facilitate physical, emotional, mental, and spiritual health. Healing touch uses touch to influence the human energy field that surrounds the body and flows to the physical body. The goal of healing touch is to restore balance and harmony to the client's energy system and promoting self-healing. Therapeutic touch was developed by Dolores Krieger, a nurse, and Dora Coons, a natural healer. It used the practitioner's sensing blockages in a client's energy field. Therapeutic touch is useful in relaxation, pain reduction, palliative care, and wound healing. Biological therapies. Dating back to more than 60,000 years ago, humans have used natural products like plants, animals, microorganisms, and marine organisms as medicine to treat and alleviate disease. In the United States, herbal or botanical therapies, prebiotics and probiotics, nutritional supplements, vitamin and mineral supplements are widely used by the general population. In 2012, 52% of Americans took at least one dietary vitamin or mineral supplement, and another 18% used a non-vitamin or non-mineral product to improve wellness, energy, or memory/concentration, or to prevent disease. Americans spent approximately $12.8 billion on these out-of-pocket purchases, or nearly 1/4 of their spending on prescriptive medications. Omega-3 fatty acids, such as fish oils, have been found to substantially reduce levels of triglycerides and are the most common non-vitamin or non-mineral supplement taken by adults and children alike. Other popular supplements include glucosamine and/or chondroitin, probiotics, melatonin, coenzyme Q10, echinacea, garlic, ginger, and ginkgo biloba. Natural products can be used alone or in conjunction with other herbal or prescriptive medications safely. Unfortunately, natural does not automatically mean safe. Thus, knowledge of natural products' contents and actions is key to ensuring that they are used wisely. Some otherwise safe compounds may interact or react to other natural or prescriptive ingredients with slight to severe consequences. For example, the plant Ephedra sinica was once used in popular supplements for energy, athletic enhancement, and weight loss, but its pairing with caffeine potentiated its already serious adverse effects, leading to heart attacks and stroke in some cases. The FDA has now banned the use of ephedra in the United States. St. John wort, an antidepressant herb, can interfere with certain anti-cancer medications. Vitamin C, a very safe water-soluble vitamin, in high doses can negatively affect radiation and chemotherapy. Ideally, clients will provide a detailed list of all medications and supplements they take to their nurse before starting any new treatments. Knowledge of natural products and their actions is also a great tool for nurses to better understand clients' perceptions of health. Identifying natural products' actions and their interactions is beneficial in optimizing their efficacy and minimizing inefficiency.